Thanks, Stephanie. Hi, everyone. I'm actually here with Ava McClellan, who's also in the Roche family, but also in a co-founder of Unlocking Eve, which is the foundation that we started last year. But I want to talk first about women in finance and why that is important. As Joanne mentioned earlier, there's not a problem of funding, but it's really how to deploy the funding. And I think to have women in leadership positions or decision-making positions in finance to be able to allocate the resources, you need to be able to understand the constituency and the community that is being represented. So, for me as a person of color, but also as a woman, understanding what we are going through within our patient population, but also in leadership. This is something that I carry with me as a finance leader in Roche, but also as we're trying to build our organization of Unlocking Eve. I think as we are being faced, as all of us are leaders here, as we are faced with really different criteria to make decisions, it's not as simple as just funding or P&L. We really need to deliver healthcare outcomes. That's why Unlocking Eve was born. This is really our service to the world and to Africa to make sure that we are building the right leaders that have an integrated characteristic to be able to create these decisions in these complex environments. So Ava will share, her experience in the countries in Roche and also Unlocking Eve leadership.
Yeah, just to double down on that, we've heard from a lot of you in terms of what's needed, what are the barriers and accelerators. And one of the things we're on a mission to do is unlocking this new kind of leadership in both men and women. Nowhere is it more evident that leaders than in healthcare. Specifically, women make up 52% of the population. 70% of healthcare workers are women, and those making decisions for health outcomes of their families and their societies are women, yet very few are in decision-making roles. And so this mismatch, which we suspect and we know is also the case in the region and continent of Africa, is what really strikes us. How do we ensure that those accountable for health outcomes for society, for men, women, kids, girls, and boys, are also at the table designing the systems for which they're fundamentally responsible of the outcomes? And on the second thing is, how do we ensure that leaders, that once they get into those decision-making roles, again, women, but also the leaders that are in the current decision-making roles, whether it be in finance, ministers of health, anybody accountable for healthcare, have the necessary skills to lead in a way that is integrated. Because during the pandemic, we started to observe globally leaders that were able to deploy both decisiveness and kind of the traditional traits attributed to masculine leadership, together with compassion and empathy and the traits traditionally attributed to feminine leadership, had 6 times less deaths due to COVID-19 than countries led by leaders that did not have that integrated way of leading. And so that really sprung us into action to really work with leaders across the world in terms of having resources and having scaffolding to, one, build a purposefully driven network of decision makers, working with those decision makers to change the criteria for what excellence in leadership ought to look like. And then working with communities, and we're coming to Africa in April, and looking at what are the systemic barriers and accelerators that these leaders are experiencing that maybe we need to either accelerate or remove, so that when they get to those positions, or those that are already in those positions, certainly women, but also men, that they are able to lead differently, because that's what we're hearing around the world is a big unlock. So if you believe in the notion that unlocking this new form of leadership, if you yourself are struggling with partnerships, it's really easy to say, but how do you lead as a co-partner? What does leadership look like in a co-partnership? How do we create shared outcomes? And then how do we deliver against those outcomes along the way? those things are easier said than done. Having worked in many, many countries, delivering outcomes, delivering P&L, we say partnership, but it's much harder. So how can we work together to really advance that? So I think that's all we wanted to share. But anything other you wanted to close on, Kaye?
No, thank you. Thank you, Joanne, and everyone in the room.